Hi, how are you?
Hello. Hi, Anideep. How are
Hi,
you?
I'm doing
Doing
good. How are
good?
you?
I'm good. I'm good.
Yeah,
Please have a
yeah.
seat.
Thank you.
How you been?
Yeah, I'm doing good.
Yeah.
It's
Okay.
good time.
Great. Yeah. So it's been almost 5 months, right?
Yeah,
You're
yeah,
doing great.
exactly.
There is good results that I
Yeah,
see, right?
yeah,
Okay.
yeah,
Great. Right. So I think you have a couple of questions
yeah,
and some doubts that they were telling me.
exactly.
Yeah.
Yeah,
You can
yeah,
tell me. What is
yeah.
it? I can help you with those.
Sure. So this is my 5 months hair transplant result. So you have a few questions. So just want to clarify them. So it's been 5 months, right? Is it fine to continue the medication? Should I take Dutestard? Is it okay to continue? Do you suggest anything like that?
Yeah, so see, your age is only 26 years old, and but still you had about grade 6 baldness, right? Your DHT levels are very high, so that's why I have to give you dutasteride or finasteride for maybe a duration of 6 months, and then we'll reduce the dose. Okay, so we will do the cyclical therapy for you.
So I've been using it from quite a long time, right? So do you see any side effects on that if I continue the using of medicines because it's been 5 months? So if you have any side effects, you can definitely tell me so that it should work for me. I'll just go through it.
So see, if you Google it, if you read any books or anything about it, you may see that there are many side effects. That's why I have many patients coming and asking me, like, ma'am, there are these many side effects and all. What will I face? So you don't have to worry. There are many things, but up to this many studies we have done, we have seen so many patients, but we have not come across any as such side effects. So don't worry.
And so currently my age is 26 years. So depending upon other age groups, right? So what do you suggest? Let's say if I am 26 and you're giving certain amount of dosage, and for the other person who is older than me or younger than me, what will be the different type of dosage you'll be administering? So do you can clarify anything on that if you have?
Yes, so I see since 5 months you're taking one tablet daily, right?
Yeah.
So one more month you continue the same and then we'll reduce the dose, that is alternate days. And we'll continue that for another 6 to 8 months and then you contact us. So according to your, any side effects are there or not, according to that, we'll customize it for you. So don't worry.
So one more thing I just wanted to understand is what is the difference between dutasteride and the finasteride? So when do we use that and when do we use this? So what are the advantages and disadvantages?
Yeah, so see, finasteride and dutasteride. Finasteride is actually FDA approved, dutasteride is not. I will tell you that finasteride is actually alpha 1 blocker, whereas dutasteride is alpha 1 plus alpha 2 blocker. So if you have a higher grade of baldness, if you have more hair fall and stuff, so then we will put you on dutasteride, right? As you had suffered almost grade 6 baldness, that's why we had put you on dutasteride. So like there are many females having such kind of baldness or hair fall, then we'll put them on finasteride, right? So both are equally good, but depending on the level of baldness, we decide the medicine.
So, as you know, there are different ways of taking medication, right? Whether it may be oral or topical administration. So, what might be the difference between applying on the hair and scalp and taking the medicine orally? So, what is better and which might give more results, or if it is equally giving better results? So, you can suggest me whatever is preferable on that.
See, as you know, there are oral plus topical medications available. In the topical medication also with minoxidil, they have finasteride, which is added. It is a supportive therapy. It is not a standalone therapy. I would not recommend it as a standalone therapy. If you take orally, it will act better and it will help. It will help you better, right? So I would always recommend you take oral plus topical medications. And if you want to just take oral, that is also fine. But oral works better.
So, apart from these medicines, right, any other alternative sources of medicines or anything like that, which might help me in increasing the hair growth and keeping it without any hair fall and maintaining the good health of the hair. So if there's anything that you can suggest me.
Right. So you have asked a good question: how to reduce the dosage and what are the alternative supplements? See, DHT levels. There are many studies which shows that DHT levels come down when you have a good amount of sleep. That is at least 6 to 8 hours of sleep at night. Reduce stress levels. If you perform certain exercises, yoga, and everything. Plus, you have a balanced diet. Okay, you should be having certain biotin supplements, certain omega fatty acids, that is antioxidants, right? And a certain diet which is rich in, like, see, there's cashew, there's walnuts,
Yeah.
there's mushrooms, there's carrots, peanuts, everything, right? So if you take all this, your DHT levels are going to go down,
Yeah.
and the supplements that we'll be giving you, we can reduce the dose as soon as possible. So that will be very helpful for you. Okay. Dosage absolutely changes according to the age. Now you're 26, but as we have seen according to many studies and all, now even 26-year-old, they're facing lots of hair fall and stuff, right? So for them, we keep a higher dose. As you age, maybe the testosterone will come down, so the dose will decrease. This is the diet chart that I'm giving you. There are many things you can follow these steps. So as soon as you follow this, we will be able to reduce the dose as soon as possible, right? So
Yeah.
please follow this.
Sure.
Okay.